So I'm Chase DiMaggio with the Burlington Church of Christ, and this morning we're going to be talking about COVID-19 with Dr. Pamela Bradt, and I want to tell you a little bit about her. She's an MD with a master's in public health who works for the Institute of Clinical and Economic Review, which is a nonprofit health policy organization for the US, and her job position is Chief Scientific Officer. And she's going to be spending some time with us today talking about our risks, talking a little bit about how COVID affects us and how we can kind of gauge our own risks as we come in contact with other people. As we know right now in our world and in our community, we are kind of just dealing with a lot of people going back out into the community again, and how that affects our risks is going to be important to just how we move forward. So we're going to be talking a little bit about that. Thank you everyone for coming, and I'm going to go ahead and mute everyone and just ask not to unmute yourself until the question time, then we can kind of go from there. Okay. Pam, I hopefully I've unmuted you, and if you'd like to, please share with us about COVID-19, and we just would love to hear from you.
Thank you, Chase. I hope everybody can hear me okay. I am going to start to share my screen now. And there we go. So this presentation is going to be very short, just a handful of slides to share some very basic information. And we really wanted, Chase and I really wanted to leave lots of time at the end for you to ask questions. So I'm just moving this around on my screen a bit. So what we're going to talk about today are some basic facts about coronavirus. Some of these you've heard on the news and some of them you haven't. I'm then going to share a very basic framework for understanding any kind of disease, whether it's coronavirus or anything else. And then what we really wanted to focus the discussion on today are how do we make decisions about risk? So that will be the focus. So just to share a little bit with you about coronavirus. So first of all, COVID-19, the disease, is caused by a virus and not a bacteria. This is important because antibiotics, which we take for stuff like strep throat or any type of urinary tract infection, for example, we use antibiotics for that because those are caused by bacterial infections. But this is a virus that we're talking about. Viruses and bacteria, while both are pathogens, which means that they cause disease, they're very, very different from each other. And one way that they're very different is the size. So just to give you an idea about the size of virus, if you look at this picture on the right-hand side of the screen, what you see is a blown-up cartoon of a single human hair, just to give you an idea about size here. To the right of that, what you see in the blue circle, that's about the size of dust particles and pollen relative to the size of a human hair strand. When you move further to the right, the yellow circle, this is just to give, this isn't actual, this is just to give you relative size idea. That yellow circle is about the size of a bacteria. Now, a bacteria we can't see with the naked eye, but we can see a bacteria under the microscope. So when you compare the size of the bacteria to the size of a dust particle to the size of one human hair, you get to see in the scale difference there. And then when we talk about a virus, this is represented by the dot to the far right. Viruses are so small that we're not able to see them under a microscope. We can only capture them and visualize them using electron microscopy, not regular microscopy. So the reason that this is relevant is this has to do with helping us understand why it's so easy for viruses to spread, and why when we talk about wearing masks, we're really talking about certain types of masks, and we're talking about things like N95, for example, and it really has to do with the fact that viruses are so tiny. Now, the other thing that's different, one of the other things that's different about a virus is that it is not a living organism. So a bacteria, a single bacteria is like its own little contained living organism. It has its own genetic material, it has its own cell wall, it has its own energy generation machinery inside of it, and it can, you know, work that way. And antibiotics work against all those parts of the bacteria. A virus is not a living organism. It is nothing more than genetic material that has a protein layer out around the outside of it. So it's super tiny. It's just genetic material floating around. And the way that it works is by getting into a cell that has all the other components that it needs. And it gets in there and it uses that cell's machinery to make more cells that have more virus. So that's an important part of understanding this virus as we evolve our understanding over time. There are 7 human coronaviruses today. And the virus that causes COVID-19 is a coronavirus. And as you've probably seen on the news, the reason it's called that is because when you do look at it using electron microscopy, it has the shape of a crown. And so that's how it got the name coronavirus. So 4 of the 7 of these viruses really cause non-serious respiratory infection known as the common cold. And although it wasn't discovered to be the cause or the common cause of the common cold until the 1960s, we believe that it's been in humans for at least 500 to 800 years. So it goes back a long time, and the human has been fighting this for a long time. So we're pretty good at fighting it off. However, in 2002, we found a mutation of this virus, or a changed virus, that caused really serious infection, pneumonia, and death in patients, and that was named SARS-CoV. That virus also evolved 10 years later and was mainly found in the Middle East to cause a related type of serious respiratory infection, and that was called MERS. And then the virus that we know today was identified in 2019 and is called SARS-CoV-2. And so what these names mean are the virus that causes COVID-19 is called SARS-CoV-2, and that comes from the names severe acute respiratory syndrome coronavirus number 2. The name of the illness that virus causes is COVID-19, and that comes from the words coronavirus disease 2019. So the virus, when we're talking about all this, is called SARS-CoV-2, and the name of the illness that virus causes is COVID-19. In terms of just having a really basic framework for understanding and talking about any disease, both patients and clinicians and researchers kind of think about buckets of questions. And so if you're a patient, one of your questions, your first question is, am I sick? You might ask, what's going to happen to me if I get sick? What caused me to get sick? And what can I do to feel better? And so the types of questions that we're talking about for this illness and for any other fall into the buckets of diagnosis, so what's wrong with me? what will happen to me over time when I have this disease or infection, that's prognosis. What caused me to get sick, that's etiology. And what can I do to feel better, that's treatment. The reason that I'm breaking these out is that when we do research in any given area, and when the media talks about this, whether it's on the nightly news or any other kind of journal that you might read, the newspaper, a lot of times we kind of talk about all these different categories of information together. But in fact, there are very different types of studies and very different types of study designs that answer questions differently depending on the type of question that it is. And this is important because as new information comes out and as we're consuming that information and using it to make decisions, it's actually really helpful for us to keep it straight by putting it into these kinds of categories. So let's talk just briefly about diagnosing COVID-19. And I know that there have been lots of questions about this, and it's so important, but we're very early in our understanding on how to diagnose this disease. So I'm not going to spend a lot of time on it. I want to talk more about risk, but at any time I can put together a presentation and we can talk in some detail about this later. First of all, what's important to understand is that right now there is no gold standard for diagnosing COVID-19. What does that mean? Well, a gold standard is a test that if you run it on somebody who's sick, that you've got a very, very high, if not 100% chance of correctly identifying what's making them sick. A perfect example is for a common bacterial infection like strep throat. So if somebody comes to the office with fever and a sore throat, and you swab the throat and you look at that under the microscope, you can actually see the bacteria that causes strep. Streptococcus is the name of the bacteria. You can see it. And when you see it under the microscope, you say, you've got strep throat. Now, there are lots of screening tests for strep throat, like the rapid strep test, which you do a swab in the throat. You don't look at it under a microscope. You run a test on it, and it gives you some information about, is this strep throat or not? It's not perfect. It's not 100% accurate, but it's pretty accurate, and so people use it all the time. The only reason that we're able to use it, though, is because that screening test has been tested against the gold standard, which is to see the actual bacteria under the microscope. In this case, with COVID-19, we don't have a gold standard test yet. And so what we have to do instead of running some test is to use a case definition. So all over the world, people are making decisions about whether or not somebody has COVID-19 based on a collection of information, not just a single test. And that collection of information is made up of the following things. What's the person's history of exposure to COVID-19? Did they have any direct contact with people that we are pretty certain have COVID-19? So the history of exposure. What are their signs and symptoms of the disease? A sign is something that anybody can observe about the person. And a symptom is what the person experiences themselves. So, does the person have the common things associated with COVID, like fever, cough, pneumonia, sore throat, runny nose, headache, shortness of breath, etc.? As you can imagine, there are lots of illnesses that have some of these same signs and symptoms. So that's why just having a few of these isn't 100% accurate in saying that somebody has COVID-19. And finally, there are laboratory test results. And this is kind of tricky because right now, because we don't have a gold standard diagnostic test in the medical community, there are tests out there for COVID-19. We don't know really how accurate they are. And that's why you're going to see on the nightly news from time to time that there are some tests that are found to be not very accurate, some that are more accurate, but right now it's still a bit of a guess. And so the way that people are diagnosed with COVID-19 is based on overall, what's their exposure, what are their signs and symptoms, and are there any laboratory test results that are pointing in that direction as well. The thing that I'll let you know that's a little bit surprising is that the way that a case is defined is a little bit different from one country to the next. So, while everybody is looking for these three categories of information, history of exposure, signs and symptoms, and test results, they're all a little bit different. The criteria for being a case is a little different from country to country, okay? So there's still quite a bit of uncertainty in diagnosing COVID-19. And what you'll find is that over time, the scientific community, as it continues to work on this disease, will start to get better and better at diagnosing COVID-19. There are important implications to that. The numbers of COVID-19 cases will look different based on how accurate any given test is. So over time, we will have tests that will be very accurate and we will find a gold standard, but we don't have it right now. Now, the real focus, this is kind of all background, and the reason I wanted to give this to you is because as new information becomes available and you're reading about it or seeing it on the news, this kind of general overview will help you better understand it and use it for your own decision making. But one of the most important day-to-day decisions that any of us have to make is really around how much risk do we want to take in going to the grocery store or going to church or going to visit with friends. And that's what I want to share with you today. So there were two categories of information that I talked about earlier a few slides ago. One is the category of questions around what caused me to get sick, and one is what will happen to me if I do get sick. So etiology and prognosis. What I want to talk about right now is what is the risk of getting infected with the virus. What I'm going to be sharing with you comes directly from the medical literature. This has just been published. So these are all things that have just been published in the literature in the major journals like the New England Journal of Medicine and the Journal of the American Medical Association. And I'm going to break it down into two major groups of information. One, the mechanics of respiratory droplets, and we're going to see a couple videos. And two is to really talk about, okay, so now that we understand the mechanics of respiratory droplets, how does that translate into actual risk for populations and for us? So let me first share with you a video that looks at how respiratory droplets, and that's just a fancy term for saying spit, how spit is transmitted when somebody talks loudly, with a regular voice, and with or without a mask. So I'm going to do a couple things here and click into this. Okay, I'm just moving some things around so I can get to this. Let me go back. Let me just give it a second to load fully. First, let me orient you to, I'm going to orient you to what you're going to see here. You're going to hear the person who's conducting this experiment, you're going to hear him giving instructions to the person that they're videotaping. And what you're going to see right in the middle of the screen are some green, little tiny green flashes. And that is representing particles of spit that are coming out of the person's mouth when he's talking. And the green is the color that it is, and it's lighting up because of laser. They're shining laser through it. Okay, so let's do this. That's the person doing the study, and he says, now I'm recording. So what you just saw, those green flecks, that's spit.
Hey,
That's
Pam.
coming out when the guy is speaking loudly.
Hey, Pam.
Yeah.
We actually can't see that. Could you drop out this screen and then put up the screen you just showed us?
Yeah, let's see.
So you just stop sharing this one and share a different one and take us to that webpage.
Oh, okay, thank you. Yes, I will. I'm just backing up the video.
Mm-hmm.
And I am going to stop sharing this screen. Oh, I see. Thank you.
Mm-hmm.
Can you see that?
Yes.
Okay, great. Okay, so here we go. And you're going to be looking right in the middle for the green.
Okay.
Here we go. Okay, so that's the green are the spit particles that are coming out with a person speaking loudly. And now the person's going to put the mask on, and you're going to be looking in the same area for the green. Okay, so now you can see really quite a difference in the amount of spit that comes out when the person has a mask on and when he doesn't. All right, so now what I'd like to do is to show you another video. I've got to switch over for a second to get to the next screen. Going to take me just a second here. Now let me just check to see what I'm sharing. Okay, excellent. Now what I'm going to show you is another video of somebody sneezing. Now there's a lot of videos on YouTube of simulated coughing and sneezing, etc. But this is an actual person sneezing. And what you see, just to start off with, what you're seeing on the screen, the white, is all the mucus, the snot, the spit that's coming out of the nose and the mouth during the sneeze. And you're seeing that it's going way past 20 inches. You're going to see another version of this where they didn't limit how far it could go. And then there's going to be one more version that you see. Okay, so now we should be back to the slides. Can everybody see the slides again?
Yes, we can. Thank
Okay,
you.
great. So one of the things that I wanted to point out here and to show you is how far that sneeze went. And it went much further than our 6 feet of social distancing. So just a reminder, this is a healthy person just sneezing. And you can see that this sneeze went as far as 8 meters, which translates to about 24 feet. So without any kind of covering at all, you really get a lot of snot and respiratory droplets really going a fair distance. So what does this mean and how does this translate into risk, and specifically into risk with COVID-19? So this is information that was published on June the 27th. So this is not long ago at all. It's the most recent information we have. And this is risk that's been documented in real populations, okay? This was a pretty remarkable effort by the researchers. They reviewed every scientific paper that was available related to transmission of COVID-19 across the world. And so they reviewed about 30,000 papers, which is unbelievable. It covered almost 26,000 patients in 16 countries and across 6 continents. So this truly is the most comprehensive information that's available. And what they found is when you look at, let's say, 100 people, and they are less than 1 meter apart from each other. 1 meter translates into about 3.3 feet, or a little over 3 feet. Their baseline risk of getting COVID-19 was approximately 13%. And the way that I'm demonstrating this is it's about 13 people out of 100, okay? So about 13 people out of 100 would get COVID-19 if they were less than 3.3 feet apart. If you ensure that everybody is at least 3.3 feet apart, that risk of transmission goes down substantially. It goes from 13 people per 100 down to a little over 2.5 people per 100, or 2.6%. That's actually a pretty significant decrease in risk. Now, what happens if you go even further apart? Well, interestingly, if you go twice as far apart, 2 meters or 6.6 feet apart, the risk of transmission goes down from 13% to a little over 1%, 1.3. And the really great thing about the distancing piece is that for every 3 feet that you add to your social distancing, you decrease the risk of transmission of COVID-19 by a factor of 2. So you cut your risk by about half, okay? So this is really good for us to know. The next thing that they looked at was the risk of transmission if you wore a face mask. This does not include the social distancing, it's just the face mask. The baseline risk of transmission out of 100 without the face mask was about 17%. The risk of transmission with the face mask on fell from 17% to about 3%. That means that about 3 out of every 100 people would get COVID-19 if they wore a face mask, but they did not social distance. Now, they did not capture consistently what happens if you do both. What happens if you wear a face mask and you social distance? But if we calculate that risk mathematically, you would be at a decimal point. You'd be far less than 1%. It's about 0.00 0.04. It's very, very low. Okay, so that's why we've got these public health recommendations about wearing a face mask and about social distancing. So where are we right now? Right now, we are at the very beginning of the COVID-19 story. And our understanding, both as a community, as individuals, and as scientific community, is going to change over time. We are still very early. Everybody now has kind of a basic foundation for understanding any disease. And remember, it's in categories of diagnosis, prognosis, etiology, and treatment. You also now have the most up-to-date information about the risk of transmission of COVID-19 that's been gathered from around the world. And what you need to do is to think about, what are you comfortable with in terms of your decision to go to the grocery store, to go to church, based on the information that you have and based on social distancing and wearing a mask. And that is the end of the presentation, and now I'd like to open it up for any questions that you have.
Well, thanks, Pam, for sharing this with us. I got to say, I was grossed out by seeing that coughing, sneezing.
Yeah.
So yeah, that's really amazing how far a sneeze can go. It's absolutely, 27 feet or 24 feet. That's a huge amount of distance. Yes. So is there anyone who would like to unmute? And so I just ask if one person would unmute at a time, and then ask a question, and Dr. Bradt will go ahead and answer our questions.
Pam, is that that chart with the people there? Is that with both people wearing masks?
Yeah, that's with everybody. When it says the mask, it means that everybody in that group is wearing a mask.
And then the one where he coughs without a mask and it goes 26 feet, obviously not wearing a mask, but the chances of getting it is with somebody wearing a mask on the receiving end?
That's right. And so, and you bring up a really good point, because a mask, unless it's an N95 or an N99 mask, which is almost impossible to get if you're not a healthcare provider, masks don't protect the wearer. The mask protects the people around them, because the mask keeps the stuff from the person wearing it going out, but it doesn't protect so great coming in. And so wearing a mask is, when you see that chart with 100 people, that's assuming that all of those people are wearing masks.
Okay, thank you.
So can I ask a question?
Of course.
So when we talk about masks, so most of the masks are, whether you have a homemade one or whatever, one of the blue surgical ones or whatever. So I guess the type of mask, it doesn't matter. Like anything that's below the N95, it would basically be the same. Like we're not like distinguishing between a certain kind of homemade mask or whatever.
Yes and no. So that's a great question. I think you're asking a couple questions in that. The first is, does the type of mask matter? And it absolutely does. So homemade masks are okay. If you can look through the mask and see light, if you hold it up to the light and you see light coming through it, it's probably not going to be very effective. If it's if it's a homemade mask or a material mask, and it's got several layers to it, and it's very densely woven material, it will be very effective. If it's a surgical mask, even if it's not an N95 or an N99, it will be very effective. If it is an ill-fitting mask or a mask that, like a bandana, bandanas do almost nothing. So it has to be a mask that fits well to the bridge of your nose, fits you well around the sides of the face, fits you well under the chin. If it's a loose mask just dangling because it's too big, not very effective. Because when you sneeze or cough, stuff goes out the top, out the sides, out the bottom. It should fit pretty well up against your face, touch your skin pretty much around the face. But if you get a surgical mask, you can feel comfortable with that. And if you have a material mask that's got several layers of tightly woven material, that would be quite effective as well.
Pam, about that a little bit more. You wear glasses, I wear glasses, and we know what happens. So is there a way that we should be wearing them when we're wearing glasses? You know?
The more from an infection perspective, the more important part is that the mask fits,
Okay.
not necessarily that your glasses do. And it is it's hard. It really is. It's a pain and they fog up. And but the more important part is that the mask fits tightly and then your glasses go on top.
Okay, good to know. Thanks.
So can I just ask one more question about the mask? So
Yeah.
I saw somebody yesterday when I was picking up somebody's dog. I know she works in a rehab. The masks that have like the filter that you can change in and out, is that is that better than just having cloth, or it doesn't really matter?
Depends. So I have some of those at home as well. So there are masks that you change a filter in and out of. And there are two things that are relevant about that mask. One is, does it have a valve? If the mask has a valve, then you're not protecting anybody from yourself when you wear it, because a valve lets the air go out. It's one of the reasons why it's more comfortable to wear, but it's not effective in protecting others from you. Now, depending on the filter that you use to go inside it, that could be used, depending on the type of filter that it is, to protect the person wearing the mask. So for example, I bought N99 filters and a mask with a valve in case anybody that I knew got sick with COVID that I needed to take care of at home. And so I could protect myself with almost 100% certainty and be able to take care of them without having an N95 mask. And then every time that I would get exposed, I would change the filter out. But I would not wear that mask to go to the grocery store, because while it would protect me, it wouldn't protect anybody from me. And the medical grade N95 masks protect both ways. They protect the person wearing it and they protect the people around the person wearing it. So that's why those are so highly sought.
Okay. What about washing your hands? We're all trying to wash our hands right now. Can you talk to us a little bit about that?
Yeah, so hand washing is also extremely important because viruses do live on surfaces. And you're seeing in the news a lot of back and forth about, how is this spread? How is it spread? Is it just respiratory? Can you get it from touching stuff? You can always get virus from touching stuff. And the way that it could potentially happen with COVID is, let's say that you're in the grocery store and you're driving the cart and your eye itches and you rub your eye. That's all it takes. You've got virus on your finger, you put it to a mucous membrane like your eye, or you rub your nose. And remember, those virus particles are so tiny. If if that area has been infected and you touch it and touch an eye or a nose, it's you could easily become infected. So that's why hand washing is so important. And what's really important about hand washing is the duration that you wash and friction. So whether you're using sanitizer or soap, what's really important is the friction, and that you have friction on all the surfaces of your hand for an extended period of time. It's not just that you coat your hand with soap and then rinse it. It's the soap plus the friction that disturbs that bond between the virus and your skin. So you really have to scrub. And when surgeons scrub in, or doctors scrub in between seeing really patients with very highly contagious disease, we treat the surface of the hand and the surface of each finger as a rectangle, so that you do friction on the top, the bottom, the side, and then the other side. And you do that for your hand, top and bottom. You do that for each finger, and then you do it for the tips. And we would use a brush to create as much friction as possible between the skin and either the antibacterial or the soap.
Okay, thanks.
The minimum rule of thumb is ABCs. Using your ABCs at a minimum. Surgeons and doctors will scrub for much longer than that, but for the layperson, ABCs, as you're scrubbing and creating a lot of friction.
Wow, thank you. Maybe we have time for one more question, and then our worship begins at 10:45. We'll push it back for people to have time to get here, because I know we are running a little past, and it takes time for everybody to get here. So don't drive too fast. If you're going to be attending services in person, bring your mask. But maybe one more question if someone has one.
I wanted to ask about duration of exposure, like when you're in proximity to other people, or is there much information on, like, if you're just briefly exposed, like for less than a second, versus, you know, you're standing in the area with someone like for several seconds or several minutes?
Yeah, so you're getting at a couple of pieces to that, and somebody's individual risk for transmission has to do with not only the duration of exposure, but if that person is contaminated and how much virus they're shedding. So the stage that they're at in their disease, and also that individual person's susceptibility to getting it. So you know, if you treat everybody that you see at the grocery store or any other place as if they have the virus and they're shedding actively, you don't want to be around them for any extended period of time. So you'd want to pass them quickly. And again, since the mask doesn't protect you, since the person wearing the mask isn't protected, what you want to do, what I do when I'm at the grocery store, is I hold my breath if somebody's getting too close to me, and I move quickly and get away, because I don't want to suck it in if that person were to be infected.
Okay, I did see David was raising his hand.
Yeah.
I don't want to let that dangle there. David, did you have a brief question for us?
Thank you, Bam. I appreciate everything that you've done. My question is not brief, however, and takes us into a different direction. It appears to me, from what I've been seeing, that the old are more susceptible to disastrous problems than the young. Now, if I review what you said about the 7 coronaviruses, and 4 of them are associated with the common cold, and I look up the common cold, I find 200 rhinoviruses that are also effective in creating infection in people. And the comments about the common cold are the same as the ones that I'm hearing about COVID, which is The young get it, they get sick, they get better. The old get it, and the complications can occur. What makes us think that COVID is not simply, oh, and by the way, there are no antiviral drugs for the common cold.
Right.
Therefore, there's a lot of effort now being put into creating a vaccine for COVID. And my question is, and this may be something that is right up your alley, what are the cost benefits of looking for a vaccine that may never exist?
Those are awesome questions, and we could talk a long time, and I'm happy to have more discussion offline if you'd like. The few simple answers. The first is there are lots of viruses that cause the common cold. Coronavirus is one, rhinovirus is another type. There are others, lots of them that give us similar symptoms. One of the differences between SARS-CoV-2, which causes COVID-19, and some of the other coronaviruses that don't, is how far down in the respiratory tract it goes and infects, and what kind of systemic or body-wide infection it causes. So for simple viruses that cause upper respiratory tract infection, like runny nose, kind of a scratchy throat, you don't feel great, but you can still get on with your day. That's because they're not very, they don't put too much strain on the immune system. And so they don't cause you to run a fever, which is a sign of a systemic problem. And they don't give you body aches and all that. Those kinds of infections cause your immune system to work harder than the ones that just get stuck here, and your immune system can kind of keep it in check where it entered the body. Things like the COVID-19, SARS-CoV-2, and influenza, for example, they go down into the respiratory system, into the lung, and they cause disease in the lung that then becomes a problem for the whole body. And so you get shortness of breath, you have problems getting oxygen in and out, you run a fever, and you can have really significant illness as a result of that. And that's because it just causes more stress to the immune system. So that's why it's got a different name. And it is a slight mutation from that real simple, not so toxic other types of other strains of coronavirus. In terms of the cost benefit, I love talking about that. That's what I do for a living, is to look at the clinical efficacy that you get versus the cost, both at a societal and a healthcare perspective. And there's lots of companies that are trying to identify vaccines, and some of them are motivated to do public health good, and some of them are motivated to make a lot of money. So, so they see it as a risk worth taking with their resources, and that's good for all of us in the sense that there's a lot of people trying to find a vaccine, but it will take a fair amount of time, in part because it takes a lot of time to carry out these kinds of global studies to see if this vaccine can result in an immune response that doesn't make the person sick who gets shot, but gives them protection so that when they do get exposed, they don't get the serious illness.
And then the virus mutates.
I'm sorry?
And then the virus mutates.
That's exactly right, just like influenza does.
Thank you, everyone. Thank you, Pam. It's great to have you be able to share this information with us. I did see someone else raise their hands, but unfortunately at this time we have to stop so people will have time to be able to come and worship this morning. Thank you, everyone, for being with us and just for the chance to talk about these things. What I'd like to just ask Pam is maybe we can, we should have another one of these conversations in the future. We can try to address more of people's questions. So if you're up for it, maybe in sometime we can ask you back. Would that be okay?
Absolutely, anytime.
Okay, thank you so much, and thank you everyone, and we'll see you here. And we will delay service, give people a chance to come who said that they were going to attend. So if you are looking for us online today, please know we'll have a little delay. Okay, thank you everyone. Have a wonderful day. Bye-bye.
Bye.
Bye.
I